Hey, and welcome to Pulse Education. My name is John Carrico. This is the first video in a long series of videos in which we're going to be talking about 12-lead EKGs, talking about cardiology, trying to explain all of this so that it makes sense and so you can take this information and apply it to when you're taking care of patients. All right. So thanks for being here. Please, if you have any questions, put them in the comments below and we'll do our best to answer those as we go along. And enjoy what you can. So here we go. So in starting with this, that means that we're going to start kind of at the basics. And when I say the basics, we're talking about anatomy. And I really want to talk about the layers of the heart. And more importantly, I want to talk about the perfusion of the heart and the coronary arteries. If you have a good understanding of the major coronary arteries of the heart, then you're going to find that you have a much better knowledge of kind of what you're seeing on a 12 lead, especially when it comes to looking for coronary artery occlusion on a 12 lead. So that's where we're going to start today. So the first thing we're starting off with layers of the heart. All right. Specifically, we're talking about the endocardium, the myocardium, and the epicardium. So the endocardium is that thin little fibrous layer on the inside of the heart. It's smooth on the inside, which hopefully makes sense because as blood interacts with that, as it flows by it, it doesn't get hung up. It doesn't cause any friction. It's able to move freely through that. But it's a very thin layer. The major part of the heart, the heart muscle that we think the most of is the myocardium. It's full of those millions and millions of myocytes. They're the ones that contract and create that the ventricles to expand and contract for the ventricles to actually push blood out into the body, into the lungs, etc. So that's the myocardium, the main working part of the heart. And then finally, we have the epicardium, which is the outer layer of the heart. And the most important thing I like to think about with the epicardium is that is where the coronary arteries kind of run. They run on that epicardial layer, and then they have branches that dive down into the other layers, the myocardium and into the endocardium to create that perfusion. And the reason I bring this up is because it's really important to think about that as the blood vessels run along the outside and dive down in, that really the endocardium and this inner layer of the myocardium is the farthest part downstream in terms of blood supply. So if we have an occlusion in one of our coronary arteries, that the blood that gets all the way down this is going to be oxygen starved by the time it gets down there. It's the farthest downstream. So what that means is that when the heart gets ischemic, when it doesn't get enough oxygen and it starts to have that infarction process, that injury pattern, that it's going to start on the inside of the heart and work its way outward. So the heart itself infarcts from the inside out. And we can start to see that on an EKG. As the EKG changes, we can actually see little warning signs that the heart's starting to infarct on the inside and it's starting to work its way out to what we call a transmural infarction, which goes through all three layers of the heart. All right. So if you can remember those three layers and remember the significance of those, you're going to be in good shape. So that brings us to coronary artery perfusion. Okay. So we've got a couple major arteries that we want to think about and kind of know what they do. All right. The first one is going to be our right coronary artery. So our right coronary artery kind of breaks off anteriorly from the aorta right here. All right. And it's going to wrap around and eventually make its way to the inferior part of the heart and also to the posterior part of the heart. But it's really important to think about some of the things that it perfuses along the way. All right. So as this right coronary artery perfuses, blood comes down, there's a small little branch that branches off and actually perfuses the SA node. It's called the sinoatrial node. But that's really important that the SA node, for the majority of people, gets its blood supply from the right coronary artery. The blood is going to continue coming down. It's got some branches that are going to branch off, and it's going to perfuse the right atrium, all right? And then eventually down in here to the right ventricle. And all that makes sense in terms of right coronary artery. The right atrium, the right ventricle. But part of that right ventricle, there's a little branch off that right ventricle called the atrioventricular branch. And that is going to perfuse the AV node. So already we know that we've got the SA node and the AV node, which are your primary and secondary pacemakers of the heart, are perfused by your right coronary artery. So if we have an occlusion of that vessel, and if that occlusion is way high, what we call proximal, then there's a good chance that those pacemakers could get knocked out. That their SA node and the AV node, if they're not getting blood, they can't do their job. And because we did that, oftentimes we see these patients as bradycardic and sometimes extremely bradycardic. So it's one of those hallmark signs of a right coronary artery occlusion is a patient who is extremely bradycardic, as well as the signs of ischemia of infarction. Well, as this right coronary artery continues along, it actually leaves the right side of the heart, and it's going to now perfuse the left side of the heart, and specifically the inferior wall of the left ventricle. All right, so it wraps around and gets that inferior wall of the left ventricle. And then eventually, for about 80 or 90% of the people walking around in the world, that blood supply of the right coronary artery wraps around to the posterior. So I got a little picture over here. So it's going to wrap around over here, and it's going to perfuse the back of the heart, the posterior wall of the heart. We've got an artery back here called the posterior descending artery, the PDA. And that right coronary artery is going to send blood all the way around and perfuse the back side of the heart. Well, there's about 10% of the population whose blood supply comes from the other side. The posterior wall of the heart actually gets its blood from the left side of the heart, from the circumflex artery, which we'll talk about here shortly. But their blood supply comes from the left side and wraps around and gets the posterior wall of the heart. But that's our right coronary artery, right here, coming down. So then, on the other side of the heart, we have the left side of the heart in terms of how it gets perfused. So it starts off with, right here, we've got the left main coronary artery, all right? The left main coronary artery provides the majority of the blood to the left side of the heart. It's very short, though. It's only a couple centimeters long before it kind of branches off. But if we get an occlusion up there in that left main coronary artery, that can be really, really fatal for our patients, often referred to as a widowmaker. We have to worry about that. All right. So from there, after this left main coronary artery, it bifurcates, or it splits, all right? And the first major split that we see here is what we call the left anterior descending artery. So the LAD, and that splits here and it comes down the anterior portion of this left ventricle. And it perfuses roughly about 2/3 of the anterior part of the heart. It's also got a couple small branches that perfuse some of our conduction system, which I'll explain conduction system in one of our later videos, all right? But it's our branches off here that is going to help us help the heart in terms of its conduction. The LAD is a major, major blood vessel, and when we get occlusions of this LAD, all right, this can be, for patients, this can send the heart to be very irritable, and oftentimes patients who have left anterior descending occlusions can go into a lethal rhythm, VFib, or ventricular tachycardia. The other split over here after the left anterior descending is our circumflex. All right, our circumflex is going to come around here, and it's going to perfuse the lateral portion of the left ventricle, so the side wall of the heart. And again, as I said earlier, for about 10% of the population, it's going to come and wrap itself around and perfuse the posterior wall of the heart as well, okay? So in reviewing, we've got our right coronary artery, our left main artery, which bifurcates into the left anterior descending artery and into the circumflex artery, okay? If you can remember those 4 main coronary arteries, you're going to be in really good shape in terms of thinking about how they perfuse the different areas of the heart that we're going to look at on the 12-lead ECG. All right, and so again, I just have it wrapped up here, the different ones that we're looking at. The right coronary artery, sinoatrial branch, and it perfuses that SA node, the right atrium, down into the right ventricle, eventually perfusing the AV node, all the way into the left side of the heart where it's going to get the inferior wall of the left ventricle, and again, for the majority of the people, the posterior wall of the left ventricle. The left side of the heart, we got our left main coronary artery. We're going to bifurcate into our left anterior descending, and that's going to perfuse the anterior 2/3 of the heart, the septum or the ventricular septum that separates the left and right ventricle, and then it's going to perfuse the conduction system or parts of it, the right bundle branch and the anterior fascicle of the left bundle branch, which we'll explain in a subsequent video. And then we have our circumflex artery, which is going to perfuse the lateral wall of the left ventricle. And again, for the minority of the people out there, it's also going to wrap around and perfuse the posterior wall of the left ventricle. So if we look at it from the 12 lead perspective in terms of the different areas we're going to get blood flow from, our leads 2, 3, and AVF, which we refer to as our inferior leads, they're going to get their blood supply from the right coronary artery, the RCA. All that here, right coronary artery, all right? If we come over here in terms of our leads V1 and V2, we think of those as our septal leads, and that's going to get its blood supply from the LAD, the left anterior descending artery. The same will go for our V3 and V4. That's what we refer to as our anterior leads. Well, we said that the left anterior descending artery perfuses that part of the heart. So this is also going to be the LAD. And then leads V5 and V6 that often are referred to as lateral leads, but we think of those as low lateral leads. So it gets the lower part of the heart, and believe it or not, that is usually also perfused by that left anterior descending artery, which leaves us with just a couple leads left. Leads 1 and lead AVL, they're going to get their blood supply from the circumflex, because those both look at the lateral and specifically the high lateral wall of that left ventricle. And all that's left is lead AVR. We're going to talk about AVR in a different video, but AVR we don't have to worry about in terms of which blood vessel it's perfused at. It looks at the heart from a different angle than the rest of the areas of the heart. So there you have it. That's our first video right now in terms of the coronary perfusion and the different layers of the heart. Thanks for joining us today. If you have comments, please, or questions, please put them in the comment box below. And again, make sure you like and subscribe if this video is really helpful for you. And we're going to have lots and lots of more content coming your all's way. Thanks so much.